Hello everyone. So this is my second live session, and today I'll try to clear all your doubts or anything that you want to discuss about the NEET PG as well as INI-CET preparation. So let us begin this session. If you have any doubts, you can just ask in the comment section, and I'll try to answer it. So we have 20 participants till now. You can just write down your comment in the comment section, and I'll try to clarify that doubt or try to answer that, because it's very difficult to answer all of you in the Instagram or in the mail. So good afternoon, Pallavi. So someone is asking about NEET PG postponement. So as I've already told you that there is high probability, but again NB is very unpredictable. You never know what's going to happen. There were some discussion at in higher authorities about the delay, but they haven't released anything as of now. So for now, you should believe that it is going to be on 15th of June, and before that, you should give a good shot in INICET, because again there is high chance of it getting postponed. So Gitansh is asking about the approach for INICET May. So Gitansh, as only 2 or 2.5 months are left for the exam, you should now be just focusing on revising your notes that you have already prepared. Revise them as quickly as you can so that you will be able to revise all the subjects, and try to do PYQs of INICET as well as try to cover all the previous year topics. And you're good to go for the exam. Just try to practice some INICET based GTs, because those are really important when you're going for the INICET. And in this way only the preparation of INICET is different from NEET PG, because you have to practice more GTs that are based on INICET. So Jaspreet is asking, sir, is doing MCQ first and go to theory would be better for two-time revision? So there are different approaches. So I also used to do this. That I used to solve MCQ first and then go for theory. Because when I started preparing in INICET, what I did was, when I started preparing in internship, what I did कि मैंने यूजी में तो सारे सब्जेक्ट्स पढ़ ही रखे थे, तो I first solved the Q bank of Marrow, and then I went on revising the questions and the notes. So there are different approaches. You can do that definitely. You can just solve MCQ first and then revise. Pallavi is asking how I revise after first readings. My PSM Physio Medicine first reading not completed. So you should first focus on completing your first reading, because that is really important for building concepts, and then you should go for subsequent revisions, and you will realize that in subsequent revisions there is improvement in your speed as well as your quality of revision. So Kumar Abhijit is asking that he is confused between cardiosurgery and cardiology, and what is the scope of cardiosurgery. So both are really good branches. People say there is a lot of saturation in cardiology as well as CTVS, but I haven't seen any. So you can definitely go for it. Still, stenting आने के बाद भी there are a lot of patients who are going for bypass surgery. So there is never going to be less scope for these branches. Sunanda is asking, sir, how to retain everything as we go along revision. So uh, the fact behind retaining everything is that you should do more and more revision, and you should practice questions, because then only you will be able to retain the important topics. And again, you should be making a 20th copy for the volatile topics, because you have to focus on them for longer retainment. Kumar Abhijit, thank you so much. Yeah, thank you very much. So if you any have any other doubts, you can just write in the comment section, or we'll just close this discussion. Because the only purpose of coming live is because I am not able to get back to all of you in Gmail or Instagram. So better to come live and discuss about your issues. Now, someone is asking how many revisions needed for a good rank in NEET as well as INICET. So it's a very subjective thing, but minimum number of revisions should be three. उसके ऊपर you can do the n number of revisions, and it is also subjective that what are your weak subjects and what are your strong subjects. Suppose my medicine was very strong, my pediatrics are very strong, so unko I have revised for like two times only, or maybe three times. But as far as short subjects or the volatile subjects are concerned, I have revised them for 8 to 9 times. So almost 2 months left. Can I do PSM from rapid revision? So yes, if you haven't studied PSM as of now and you don't have the time for like seeing the complete videos, you can just go for the rapid revision. Your main aim should be your any subject should not be left untouched. That is your main goal. And if you have less amount of time, you should go for the rapid revision. So Nilank is asking, I have finished my first reading and now I am doing my first revision. Is it okay if I revise my main notes or should I revise the revision notes? So जिस भी नोट से आपने फर्स्ट रीडिंग करी है, आई वुड सजेस्ट यू टू कंटिन्यू विद दैट. डोंट थिंक कि आप लेट हो तो यू शुड जस्ट स्विच नाउ टू द रिवीजन नोट्स और द रैपिड रिवीजन नोट्स. बिकॉज आपने जिस भी नोट्स पे अपना टाइम स्पेंड किया, now that should be your primary target and that should be your primary source for the revision. It will take a slightly more time, but again your quality of revision, your rank, your marks would be much better if you will keep on following the same source. So chill doctor is asking, in NEET PG 2024 I got 107 correct, was involved in counseling, started preparing again, now completed two subjects, obs gynae micro. It's taking a lot of time like first reading. So I would say that since you have already got 107 correct in the last NEET, just don't focus on like reading or seeing the videos again. Just try to revise your notes as quickly as you can so that you will be having a lot of revision, as well as try to focus on things that you lack in the last revision or the last time of your preparation. Suppose if you think that you have practiced less number of GTs, then you should focus on that. If you practice less number of questions, then you should focus on that. So Aditya is saying, bro, start teaching at White Army. So Aditya, I've already taken some sessions there, but now I think I should take lectures on the my own channel only, because White Army is calling a lot of people to teach on their own page, earning through other people's and promoting his own channel. I don't know. There's no. I'm not seeing any point in teaching there. So Udit is asking, is it doable if I start now for NEET PG 25 with job? I get 22,000 rank in last year NEET. So yes, definitely it's a really doable thing, because since you have already got 22,000 rank in a NEET PG 2024 and it's a good rank, so you can definitely get a good rank in this NEET PG as well with you if you'll continue your job. So one thing I'll like to tell you, I have uh, I have cleared all my exams appearing. So when I was in internship, I cleared NEET PG. When I was in MD third year, I cleared NEET SS, as well as when I was in class 12th, I cleared NEET UG. So बहुत लोगों को ऐसा लगता है कि हम JRship कर रहे हैं तो इट्स वेरी लेस लाइकली फॉर अस, और हम जॉब कर रहे हैं या इंटर्नशिप कर रहे हैं तो there's less chance, but trust me, that is your highest chance of getting in any entrance exam, because since you are doing job also, so your anxiety level would be on the lesser side and you can see the practical things there. Revising FA is very important. Do not add multiple sources. Yes. So Neha is asking for short subject PTR is enough. So yes, for short subjects, you should focus on the quantity of your revision, because the number of times you will revise them, the more your chances of getting the questions correct. And there are multiple questions asked from the short subject, but those are on the easier side. So you can definitely do BTR for short subjects. So Chill Doctor is asking, sir, I am doing Marrow Rapid Revision and have done it last year, but as BTR is hyped so much that I am having FOMO about. So I would say कि since you have done Rapid Revision only, you can go for the BTR. And if you have have not gone for the BTR, you should do the PYQs and Q Bank of Marrow again. Okay, so I think we should end this session because it's already 15 minutes, and I'll again come up with the another live session next week. So if you have any doubts till then, just keep it with you and just ask me in the next session. Okay? All the best.